Argus Life Sciences introducing the Amylase biosimilar anti-inflammatory anti-edematous syrup for all ages.
Amylase syrup is an anti-inflammatory and anti-edematous syrup having an active ingredient alpha amylase that hydrolyzes alpha bonds of large alpha-linked polysaccharides. Alpha amylase in amylase syrup is a natural enzyme because it is physiologically similar to the enzyme produced in our body. This bacterial-sourced alpha amylase is the most potent amylase that relieves inflammation and edema by its hydrolyzing activity at different stages of an inflammatory process.
Amylase works as an efficient anti-inflammatory product from natural origin, acts by delaying the immune response for inflammation. Controlling vascular permeability results in less edema and fasten the edema resorption. Increases the blood flow at the site of inflammation and helps in tissue repair. Attacks biofilms and microorganisms and thus reduces infection and inflammation.
Amylase syrup has an immunomodulatory action by breaking the glycoprotein markers at the phase 1 of inflammation process that decreases the vascular permeability and reduces the edema. Amylase syrup decreases the membrane permeability and limits the exudate formation, thus by swelling, and amylase attacks the polysaccharide present in the exudate, breaks down and allowing edema resorption. At the same time increases the blood flow at the site of inflammation and fasten the tissue repair. Alpha amylases have long been known for their anti-inflammatory and anti-edematous properties. They also have antibacterial and antiviral properties that have been detected more recently. Work has indeed shown that thanks to their amylolytic properties, the enzymes of this family cause the degradation of the cell wall and membrane of many bacteria that are rich in carbohydrates. In the same way, alpha amylase degrades the carbohydrate constituents present in the cellular envelope of the virus. Amylase syrup breaking the biofilms created by the microorganism which is needed for their existence. Biofilms created by microorganisms blocks the entry of antibiotics. Alpha amylase breaks the biofilms and eases the entry of antibiotics. Biofilm has polysaccharide chains. These polysaccharide chains are digested by alpha amylase and results in reduction of infection at the site of inflammation.
Amylase syrup is an efficient anti-inflammatory and anti-edematous product alone and support concomitant use of antibiotics in the case of infection. It is a natural enzyme product, because it is physiologically similar to the enzyme present in our body, but it is more potent than any other amylase. Study shows that alpha amylase is better effective without any side effects when compared with NSAIDs.
Amylase syrup is a physiologically natural enzyme. It is suitable for all ages above 6 months. Amylase syrup doesn't make any gastric irritation and at the same time supports natural digestion. Amylase syrup is indicated in the therapy and prophylaxis of inflammation and edema in various situations and also an adjunct to antibiotic therapy in the following indications: tonsillitis, sinusitis, laryngitis, bronchitis, acute and chronic lung diseases, otorhinolaryngology, rhinoplasty, tonsillectomy, laryngectomy, nasal polypectomy, nasal septum resection. Respiratory complications of infectious diseases. Amylase syrup is also indicated for the management of inflammation and edema associated with post-traumatic edema, post-surgical edema, injuries, dislocations, sprains, fractures. Amylase syrup is also indicated for the management of inflammation and edema associated with maxillofacial surgery, tooth extraction, apical resection, bone grafts, excision of the submaxillary glands, as a complementary treatment in periodontitis. Amylase syrup is a wonder enzyme that manages inflammation and edema safely and naturally. For more information visit www.amylase.in.